we are answering the few questions which are asked on the online. So one question is, when can we start the process? When can we start investigations for transplant recipient? So as I said, transplant recipient is a patient who is affected with the kidney disease, and the kidney disease is such severe that he usually requires some form of dialysis, either a blood dialysis, that is called a hemodialysis, and or a peritoneal dialysis, which is a form of home dialysis, which can be done at home by putting special fluid into the abdomen. That is called a peritoneal dialysis. So when these dialysis patients, they reach at this stage to receive a dialysis, to receive some form of dialysis, they are usually eligible for kidney transplantation also. So we can start the evaluation process usually when the GFR is nothing but the glomerular filtration rate, which is actual indicator of the severity of the kidney disease. So when the GFR level is usually less than 15, that is the level we can undergo transplantation, and we can start the process for transplantation by doing special tests. So the main specific tests which include in transplantation is the cross match. Cross match means where the donor prior to transplantation, we are to be sure that the donor organ is accepted in the recipient, we have to cross match the donor cells, donor lymphocytes with the recipient serum. So if the recipient or the patient having anti-donor antibodies in the serum, they react with the donor antigens which are located on the lymphocytes. So by seeing the cross-match test between the donor lymphocytes and the recipient serum, so we can assure that kidney transplantation in between these two donor and recipient pair is a safer choice. So for example, if the recipient is having the antibodies against the donor even before transplantation also, the cross-match test will be positive. That means if the recipient who is undergoing dialysis, who is having kidney disease, is having antibodies against the donor antigens, usually these antigens, they react with the donor antigens, which are these antibodies in the recipient, they react with the donor antigens located on the surface of the lymphocytes in cross-match test. So these antibodies, when they react with the antigens on the surface of lymphocytes, they cause lysis or the damage to the lymphocytes of the donor cells. So this test is called a cross-match test, and if the damage of cells is more, it's called as positive cross-match test. And normally the basic cross-match test is the tissue cross-match test, which is also called as CDC cross-match test. And when the lysis is more than 10%, it is called as positive cross-match test. And positive cross-match usually is a contraindication to the transplantation, because if we do transplantation even after positive cross-match, usually the organ will be rejected because the recipient is not accepting the organ because he is having antibodies against the donor antigens. So if you do transplantation, it will be usually a failure unless you give specific treatment. So if some recipients, they don't have any choice other than a single donor, but if the cross-match test is positive, we can do special treatment. They have to undergo recipient to reduce the antibody level in the recipient prior to transplantation. After that, they can undergo transplantation with the donor, but it is also associated with a high risk of rejection even after such therapy. So we'll see the questions which are asked online. So does a living donor get priority on the transplant list if they need a transplant sometimes in the future? Yes, these living donors, they are not patients actually. They are actually healthy individuals who are donating organ to the needy person, usually a relative. So they are usually, out of the two kidneys, one kidney is usually donated to one of their relatives who are affected with the kidney problem, who are undergoing dialysis. So after that, the donor who is usually a normal healthy person, he or she has only one kidney. So even though after donation of kidney does not lead to any means any other increased risk of kidney damage to the donor, but sometimes if in future, unfortunately, if they suffer from some kidney problem, and if they develop a GFR level of very low, that is less than 15, they are called like ESRD patients. So unfortunately, if the donor develops ESRD requiring dialysis and requiring transplantation, and we have a cadaver list that is called a Jivandan list, and these donors are given priority compared to the other recipients, because these donors they donated the kidney and they developed kidney disease, unfortunately, not by it's by choice only. So these donors are given a chance and they are given priority compared to the other recipients who are on the wait list. So this wait list is maintained by the Jivandan committee, and according to the wait list, usually at present around 3,000 patients are on wait list to receive cadaver donor organ. So they are given different scores for the recipients who are on waitlist. Based on the scores, highest score person usually he will be on the top of the list, and he or she receives the organ in priority. So this score is usually calculated depending on the duration of dialysis or any failed fistulas, AV fistulas, or like this. If a person has donated a kidney in the past to some other recipient, or if he had already undergone transplantation and there is a history of graft failure is there. So these are all the different parameters by which each recipient on the wait list is given a score. So based on the score, the top score person will be on the top of the wait list in the Jivandan list, and he or she gets the organ first. And this organ allocation is also based on the blood groups. That means the list is separate for each blood group, like A, B, O, and AB group. So each blood group list is different in Jivandan. So another question on the online, like which is a better option between dialysis and transplantation? So as I said, when the kidney disease is more severe, like it is called a stage 5 CKD, when the GFR is usually less than 15, it is called a stage 5 CKD, or there are also called as ESRD, that is end stage renal disease. And these patients, who are on follow-up with the nephrologist, these patients, when the GFR is less than 15, they undergo some form of renal replacement therapy. These renal replacement therapies, at present, we have three modes of renal replacement therapies. One is hemodialysis, another is peritoneal dialysis, another is kidney transplantation. So most of the patients, because of the logistic and financial reasons, or because of lack of availability of the donors, usually they choose some form of dialysis initially prior to transplantation. Hemodialysis is usually widely available across different districts also, towns also, and most of these patients, they are usually choose hemodialysis. Around 80% of these patients, they are on hemodialysis. Peritoneal dialysis is the second option. Usually it's not widely practiced because many of the nephrologists, they are not aware, or because of logistic reasons, they do not have facilities to continue the peritoneal dialysis at their own clinics or hospitals. So peritoneal dialysis usually performed in only few centers in the city, and in district levels, usually peritoneal dialysis usually means not started because of logistic reasons and because of non-availability of the peritoneal dialysis technicians. So peritoneal dialysis is the second option. Usually around 15% of patients, they choose peritoneal dialysis, and less than 5% of patients, they actually undergo kidney transplantation at a correct time. This is again because of the financial and logistic reasons, and because of the not availability of the donor kidneys widely. And among this transplantation, as I said, again, we have live donors and cadaver donors. So majority of them, they receive live donors because from one of the family relative, if they donate kidney, it can be kept in the patient's abdomen and is transplanted. That form of live transplantation contributes to almost 70 to 80% of all transplantation. Only 20% of cases, they undergo cadaver transplantation, which is nothing but the organ donated from the brain death donor. So we'll see the next question. So what is laparoscopic donor nephrectomy? So as I said, live donors, they can donate one of the kidneys, either right or left kidney, usually left kidney, and the donor kidney is taken out from the donor by various ways. The older method is is the open nephrectomy, where by open surgical method we have to you remove the kidney from the donor. So it is a little cumbersome, because by open method means we have to put we have to incision, we have to give a large incision to remove the kidney. And second and most recent one and most widely accepted method is the laparoscopic donor nephrectomy, where the donor kidney is removed by laparoscopic method, where laparoscopy means where you put 3 or 4 ports. Ports means small holes within the abdominal wall, and from where you can put the instruments into the abdomen. That's called laparoscopy method. And during laparoscopy method, with these instruments only, we will dissect the abdomen and will separate the kidney. And during kidney removal, we'll make a small incision on the abdomen, after which we'll remove the donor kidney. That is called as the laparoscopic donor nephrectomy. And laparoscopic donor nephrectomy main advantage is we will give you a small incision, and by putting only small holes in the abdomen, the donor morbidity will be less. The donor can be discharged soon after the surgery, maybe by day 3 or day 4 after surgery, and there won't be any much pain, and patient can be mobilized, or patient can be ambulated very easily and early. That is a major advantage. So next question on online: what is the cause of transplantation? So transplantation, as I said, live donor, we have live donor transplantation and cadaver donor transplantation. Live donor transplantation, where the living donor, usually a family relative, donates the kidney, and the cost of this live donor transplantation is usually around 5 to 6 lakhs, depending on the hospital where the patient is undergoing the surgery. Hospital and the city and other logistics, they decide the surgery cost. And with regard to the cadaver transplantation, where the organ is donated from the dying person or usually a brain death person, in this the cost of transplantation usually little higher, usually around 6 to 7 lakhs. This is also depending on the hospital. Here the cadaver donor, usually the organ is taken out from the brain death donor, and compared to the live donor, where we have to do live donor surgery on the living person, and where we have to take care of the living donor. Here in cadaver donor, after removal of kidney, there is no need to take care of the cadaver person or brain death person. The dead person is returned back to the patient relatives. So there is means, except for the recipient surgery and recipient care, the donor is not taken into consideration. So here the cost is around 6 to 7 lakhs, depending on the hospital. Next question: what are the earliest signs of rejection? So as I said, this organ transplant is a process where some organ from some other person is transplanted into some other recipient. So because of the different antigens present in both the recipient and donor, there is chance of rejection. And if there is already pre-existing antibodies in the recipient, their chances of rejection are more, but these can be predicted by cross-match test prior to the transplantation. So prior to transplantation, as I explained, we'll do cross-match test between the recipient serum and the donor cells, and we'll see the reaction between the donor recipient serum and the donor cells. If there is some reaction, we expect that rejection will occur much more frequently in these cases of positive cross-match, and we usually avoid transplantation if there is positive cross-match. But even though cross-match is negative, in many cases after transplantation, almost 20% of these cases after transplantation, even though the prior cross-match negative before transplantation, they usually suffer from rejection even after negative cross-match transplantation. This contributes to around 20 to 25% of all transplants. They suffer from rejection, some form of rejection, which is usually two types. One is called T cell mediated rejection, another is antibody mediated rejection. The rejection here, even though cross match is negative, it happens because after transplantation, the immune system of the recipient